If you are a family member on Medicare, this is one of the most important tips I could give you. If you needed some sort of rehab or skilled nursing, and you needed it in a skilled nursing facility, under Medicare, the only way they're on the hook for paying for that is if you have had a 3-day consecutive inpatient stay at a hospital. So if you went to a hospital and the first day you're in the emergency room, or the first day you're there and you're under observation instead of being checked in as inpatient, those days don't count towards the 3 consecutive days. Now, you may think I'm being dramatic by saying this is the most important rule, but think about it. When you're in a situation and you have a loved one that's injured, we just had somebody in my family very seriously injured, and of course my concern is let's get the best care, let's get them to the hospital, etc. But in the back of my mind, because I knew this rule, I knew that he had to have a 3-day consecutive inpatient stay in order to be able to have Medicare on the hook to cover the skilled nursing facility care that he's going to need after the hospital stay. The first day there, he was in the emergency room, and it wasn't until the second day that he was checked in as inpatient. And I want to read this rule to you up above so you remember it, because while you're trying to do good for your family member, this is also going to be part of protecting them. So let's look at this language up above so you know what you have to think about in this situation. So in order to have a qualifying stay at the hospital, you have to have 3 consecutive days or more, starting with the day the hospital admits you as inpatient, not including the day you leave the hospital. The time you spent at the hospital under observation, so they haven't checked you in as inpatient or in the emergency room before you're admitted, does not count towards the 3-day qualifying inpatient hospital stay, even if you're there overnight. So remember this rule, because it could make a huge difference in the future if you are trying to help a loved one or yourself when you have some sort of an emergency or you need skilled care.